About lung cancer. Lung cancer or lung carcinoma is a type of cancer that forms in tissues of the lung, usually in the cells that line the air passages. It has been proven by scientists that it can lead to death in both men and women. Lung cancers are broadly classified into two different types. This variant of lung cancer grows differently and is treated in separate ways. The types of lung cancer are small cell lung cancers, SCLC. Almost all cases of small cell lung cancer are due to cigarette smoking. It's fast-growing cancer that spreads much more quickly than other types of lung cancer. Non-small cell lung, NSCLC. Non-small cell lung cancer is the most common type of lung cancer. It grows and spreads more slowly than small cell lung cancer. Before we continue, kindly subscribe and click the bell icon so you don't miss out on our new videos. Firsty, let's talk about persons WHO are at risk of cancer. Lung cancer is one cancer that can affect anyone, but certain factors would raise one's risk of getting it. They include smoking. This is the most important risk factor for lung cancer. Tobacco smoking causes about 9 out of 10 cases of lung cancer in men and about 8 out of 10 cases of lung cancer in women. The earlier in life you start smoking, the longer you smoke, and the more cigarettes you smoke per day, the greater your risk of lung cancer. The risk is also greater if you smoke a lot and drink alcohol every day or take beta-carotene supplements. If you have quit smoking, your risk will be lower than if you had kept smoking. But you will still have a higher risk than people who never smoked. Secondhand smoke, which is the combination of smoke that comes from a cigarette and smoke breathed out by a smoker. When you inhale it, you are exposed to the same cancer-causing agents as smokers, although in smaller amounts. Family history of lung cancer. Being exposed to asbestos, arsenic, chromium, beryllium, nickel, soot, or tar in the workplace. Being exposed to radiation, such as from radiation therapy to the breast or chest. Certain imaging tests such as CT scans. HIV infection. Air pollution. Symptoms of lung cancer. At times, lung cancer doesn't cause or show any signs or symptoms. It may be found during an X-ray for the chest on another condition. However, if you are having the following symptoms, it's pertinent you see a doctor who will schedule a chest X-ray appointment for you, as chances are that you may have lung cancer. Chest pain or discomfort. A cough that doesn't go away or gets worse over time. Trouble breathing. Wheezing. Blood in sputum. Mucus coughed up from the lungs. Hoarseness. Loss of appetite. Weight loss for no known reason. Fatigue. Trouble swallowing. Swelling in the face and/or veins in the neck. Here are pretty bad foods for lung cancer. Eating healthy is very important, especially if you have been diagnosed with a certain health condition such as lung cancer. However, you may not know what to eat if you don't consult a doctor or do proper research. For one diagnosed with lung cancer, some foods should be avoided. This is because cancer treatments, like chemotherapy, will take a toll on your white blood cells, which is the body's frontline fighters against infection. So the germs and bacteria common in some foods may find it easier to get into your system. Such foods include greasy, fried, or super spicy foods, which can lead to queasiness and diarrhea. Very hot foods and liquids. These can upset your stomach and cause lots of discomforts. Drinking a lot of caffeine can make one lose fluids, thereby causing constipation. Avoid foods like cold cuts. Uncooked, dry-cured salami, and pre-made meat salads can carry Listeria bacteria, a trigger for food poisoning. Be cautious about your eggs intake, unless they're well-cooked eggs. Even very fresh ones with clean shells might have Salmonella, the bacteria that cause thousands of food poisoning cases and a few dozen deaths every year. Don't use eggs that aren't refrigerated or that are cracked. Stay away from foods that might have raw eggs, including Caesar salad dressing, smoothies, raw cookie dough, homemade mayo, and hollandaise sauce. Desist from drinks or eating raw milk or dairy products that aren't pasteurized. This may include yogurt, soft cheeses such as brie and feta, and Mexican-style cheeses like queso fresco or blanco. Raw milk can contain harmful bacteria including E. coli, Listeria, and Salmonella. Soft-serve yogurt and ice cream make the list too. You can't be sure what's in them or if the machines are clean. Scrutinize the bakery with care. Avoid anything cream or custard filled that's not refrigerated. Steer clear from eating raw vegetable sprouts, such as alfalfa, broccoli, or radish. Bacteria thrive in the moist, warm conditions where sprouts grow. Also, ignore sushi. Even lightly cooked or smoked fish can harbor harmful bacteria. This includes lox, brined or smoked salmon, and sashimi, thinly sliced raw meat or fish. Raw or undercooked shellfish, like oysters, may carry the hepatitis virus. In fact, some types of fish, even if cooked, can have high levels of mercury. Resist raw honey, raw nut butter, and unpasteurized juices. Avoid eating leftovers that have been in the fridge for more than 3 days. Do not thaw frozen fish, meat, or poultry by setting it out on the counter. It's safer to defrost in the refrigerator or in cold water that's frequently changed. Also, people with lung cancer should avoid smoking and drinking alcohol. In addition, also avoid the following. Excessive salt. The heavily salted diet should be avoided at all costs. Salt can make people retain water, and excess water can cause breathing problems. Instead of using salt or a salt substitute, try herbs and spices to enhance the flavor of food. Acidic foods and drinks. A ring of muscle forms a valve at the end of the esophagus. If the valve doesn't seal or opens too often, stomach acid can move into the esophagus. This creates heartburn, and frequent heartburn then could extend more than twice in a week. The above explained sign is called an acid reflux disease. People with lung disease may find that acid reflux increases their lung disease symptoms. Avoiding or limiting acidic foods and drinks, citrus, fruit juice, tomato sauce, coffee, and spicy foods, reduces acid reflux symptoms, and therefore, lung disease symptoms. In summary, everyone likes eating well, but with a chronic condition such as lung disease, it's more crucial to eat healthily. Always ensure you consult your doctor before you change your diet. Hope you enjoyed this video. Please take a quick moment to subscribe, like and share this video. Thanks for watching.